In the first stage, we prepare the tools to carry out blood sampling or blood collection. Her name is Laudia, the patient whose blood we will take.
The injection is pulled and pushed to release the air. Pull the sleeve up to the elbow, apply a tourniquet, tighten it, then ask the patient to raise and lower the arm 3 times.
Make sure there is a pulse that take an alcohol swab and whip it on the pleasure area. Remove the injection cap carefully. Slowly insert the syringe. Warning, you need to remember that if you make a mistake, blood will come out.
The blood will come out if we insert it wrongly. Open the lid of the syringe slowly. Insert the syringe slowly. Pull the back of the injector. Strike off tourniquet. Close it again with the injector cap.